antibody drug conjugate mechanism of action is nicely seen here as the cell wall receptors on which it binds. Then the antibody drug conjugate is internalized. In most cases, it is transported to lysosomes, which are responsible for breaking down internalized material. In the lysosome, internal conditions may destabilize the linker or antibody backbone, causing the cytotoxic component to dissociate and circulate freely inside the cell. And most cytotoxic drugs of current ADCs either bind to DNA and induce strand breakage or bind to tubulin and resulting in microtubular disruption. Both processes lead to cell death, that is apoptosis. Trastuzumab was the first agent. It binds to subdomain 4 of extracellular domain of the HER2. Several other mechanisms of actions are antibody-dependent, cell-mediated, cytotoxic, blocking HER2 cleavage and inhibiting ligand-independent activation of downstream signaling pathways. The addition of trastuzumab to taxane-based chemotherapy in various trials and showing the significant improvement for time to disease progression and OS led to approval of trastuzumab for the first-line treatment of patients with metastatic HER2-positive breast cancer by US FDA in 1998. Subjects on the control arm were allowed to cross over to trastuzumab at the time of disease progression, and the median overall survival improved from 20.3 months to 25.1 months. The toxicity of Herceptin, there is risk of congestive heart failure, asymptomatic reduction in left ventricular ejection fraction, and very low risk of infusion reactions. Despite success as a single agent or in combination with chemotherapy or endocrine therapy as first line, patients usually develop disease progression by development of resistance to trastuzumab. Continuing treatment beyond disease progression in combination with an alternative chemotherapy has demonstrated benefit. GBG 26BIG0305 trial compared capecitabine with capecitabine in combination with trastuzumab in metastatic breast cancer who progressed on trastuzumab. Continuation of trastuzumab demonstrated improvement in response rate and progression-free survival. Overall survival advantage was not observed, possibly due to early closure before the completion of accrual, and some of the patients were also switch over to the new HER2 drugs. Currently, continued HER2-directed therapy after disease progression on trastuzumab is considered the standard of care.